So to clarify, and this is another drawing, this here is the tongue, and the intrinsic muscles of the tongue are inside the tongue itself. Extrinsic muscles are styloglossus, this is the styloid process, styloglossus, hyoglossus coming from the hyoid bone to the tongue. There is a genioglossus coming from the genio, which I guess is the front portion of the mandible, glossus, genioglossus, and geniohyoid going from the front of the mandible to the hyoid bone. Here is the inferior view of the mandible. So these are the anterior digastric bellies. There's only a single submental node here on the left side. This here is the mylohyoid. If you cut it open and reflect it, you should be able to see here the geniohyoid, and there are your sublingual glands. If you cut open the geniohyoid and reflect it, you should be able to see the genioglossus. The purpose of these muscles is as follows. The geniohyoid and mylohyoid and the stylohyoid are used to elevate the hyoid bone. The styloglossus muscle helps pull the tongue up and back supraposteriorly, and such as when you swallow, you can feel the back of the tongue going up and pressing against the soft palate. That's the styloglossus. The hyoglossus helps move the tongue laterally, side to side. So there's one on the other side. The genioglossus here helps pull the tongue out, such as when you stick your tongue out. Paralysis of the genioglossus muscles means that you cannot stick your tongue out when asked to. And there's two muscles, of course, the left and right genioglossal muscles. Paralysis of the left, for example, paralysis of the left genioglossus will cause you to be unable to stick out the left side of your tongue. So only the right side, when you stick out your tongue, only the right side comes out. Here is the overview of what we have talked about of the muscle of the infrahyoid muscles. So down here you can see the superior, middle and inferior pharyngeal constrictors. The middle consisting of the thyropharyngeus and cricopharyngeus muscles, and the middle pharyngeus muscles is a single whole muscle and attached to the hyoid bone. And there's the esophagus, trachea, esophagus. Next, you see here, this is the front view. There's your thyroid cartilage, cricoid cartilage, and the trachea, the rest of the trachea. There's your thyroid gland. Down here you see the sternum, from the sternum to hyoid bone. The sternohyoid muscle has been cut and reflected to expose the underlying sternothyroid muscle, as well as the thyrohyoid muscles and the cricothyroid muscle. Here is your thyrohyoid membrane, cricothyroid ligament, and cricotracheal ligament. Now, to look here, and this is the hyoid bone, and the anatomy of the hyoid bone is that it has a body and two horns, the lesser horn and greater horn. And here I have shown what attaches to which part of the hyoid bone. So at the front here, at the very anterior portion, that's the site of attachment of the sternohyoid muscle. Just lateral to that is the site of attachment of the omohyoid muscle, and lateral to that is the site of attachment of thyrohyoid muscle. That thin line there, that's the site of attachment of the mylohyoid muscle, coming from the mandible to the hyoid bone. And here, this big area here is the geniohyoid muscle, also connected to the mandible. Posterior to that is the genioglossus, site of genioglossal muscle attachment. And finally, here is where your stylohyoid muscle attaches. I thought it would be attaching to the lesser horn, but you will have to double check that. And finally, two muscles attach, one on the lateral side of the greater horn of the hyoid bone, that is your hyoglossus muscle attachment site, and medial to that is the site of attachment of the middle pharyngeal constrictor.